नमस्ते दोस्तों, स्वागत है आपका आज के RSSDI डायबिटीज बाइट्स में। भारत एक सुंदर देश, विविधता का देश है और हम सभी ने महसूस किया है कि वैज्ञानिक प्रगति के साथ हमारा देश समृद्ध संस्कृति का भी देश है और विरासत में मिले हैं हमें विभिन्न त्योहार जो हम सभी उत्साह से मनाते हैं। बात सुनकर अच्छी लगती है, पर यही उत्सव का माहौल जो है वो ज्यादातर हमारी गतिहीन जीवन शैली जो है उसमें काफी चुनौतियां लेकर आता है। हम डायबिटीज के डॉक्टर्स को तो समझो आदत ही पड़ गई है कि ये सुनते हैं डॉक्टर साहब ईद थी तो हमने सेवैयां खाई है, बिरयानी खाई है, ओणम गया तो हमने पायसम खाया है, दिवाली थी तो हमने बहुत सारी मिठाइयां खाई है और क्रिसमस थी तो बहुत सारा केक खाया है। त्योहार चाहे कोई भी हो, हम सभी मनाते हैं और मनाते हैं खूब सारी मिठाइयों का लेन देन और सेवन करके। और इसी आदत से डायबिटीज के मरीजों के जीवन में काफी बुरा प्रभाव पड़ सकता है। हमारा डिफीट डायबिटीज का अभियान जो 1 जुलाई से शुरू हुआ है 2021 का, उसमें हम काफी जोश से लोगों को प्रेरित कर रहे हैं कि वो शुगर्स टेस्ट करें अपनी। अगर शुगर्स टेस्ट करेंगे तो ही उनका महत्व समझेगा और हम आगे चल के उनको ट्रैक भी कर सकते हैं और ट्रीट भी कर सकते हैं। तो इसी बात पर हम आज हमारी चर्चा होगी भारत के 4 एक्चुअली एंडोक्राइन डायबिटीज के विशेषज्ञों से, जो कि आपके मन में जो भी सवाल आ रहे हैं इस विषय में उन सभी प्रश्नों का उत्तर देंगे। So with that, may I invite our National President of RSSDI, Dr. Banshi Sabu, without whose encouragement and vision we could not have had RSSDI Diabetes Bytes or Defeat Diabetes as well. He has a stoic team to support him with Dr. Sanjay Agarwal and the entire executive committee. Welcome, sir, and please welcome our elite panel for today as well.
So first of all, thanks, Urvi, for nice introduction about the Diabetes and Festival and introducing the Diabetes Bytes. First of all, I am thanking Diabetes Bytes social media team of RSSDI. So they are doing really fantastic work. Some of them are already executive committee member, and I'm really thankful to Dr. Sanjay Reddy and Dr. Purvi Chawla, who is really working very hard for this moment. Today we have very eminent person, but to introduce Dr. Sv Madhu, I want to introduce. Other Dr. Sanjay Reddy will definitely introduce Sambit also. Dr. Sv Madhu, I know since long because when I became the executive member, he was the joint secretary and then he was the secretary. So I mean, one of the person to whom I look always, and very particular and very eminent endocrinologist, a professor of endocrinology and medicine at Delhi. And he's the one who has really made RSSDI in a very perfect manner. So that I must say about Dr. Sv Madhu. He's a past president of Endocrine Society of India. He was past president of RSSDI. Before that, he was secretary, joint secretary of RSSDI. Maybe for more than 15 or 18 years he served. And now also he's serving as an editor-in-chief for RSSDI Journal, which is the International Journal of Diabetes in Developing Countries. So Dr. Sv Madhu is very eminent and very key persons for RSSDI. He had seen the RSSDI progress and he himself has done a lot of activity in RSSDI. As far as research is concerned, I put that RSSDI research and in the different areas of research which he has done. And along with that, many newcomers, young doctors across the country, he supported the research under the RSSDI. So with these words, I welcome Dr. Sv Madhu to this show.
Thank you.
And Dr. Sambit, who is upcoming endocrinologist from city of Bhubaneswar, from Odisha, very active on social media. So I think he's the right person to, along with Dr. Sv Madhu, to talk on this subject. So to introduce him, we have a moderator who is an executive committee member of RSSDI, Dr. Sanjay Reddy. He will be introducing the topic as well as both the speakers. He will moderate the session also. But just to talk about this Diabetes Bytes, which we have started for more than 1 year to increase the awareness about the diabetes to the lay persons. They may have multiple questions related to diabetes. There are many myths and facts which we know about the diabetes also. which are there in field of diabetes. We started a campaign for defeat diabetes. The idea of that many of our persons who does not know about the diabetes status, what they are, whether diabetic or not, they are controlled or not, they are not tracking themselves regularly, and they are not getting the treatment also. Even those who are taking the treatment, the diabetes are not under good control. And then the festival season, which is continuously 12 months around the year, we have some or other festivals. Now, rather, I will say every weekend is a festival for us. So, how to tackle and along with diabetes. So, for that, we will be having eminent persons from all across the country. So, Dr. Sanjay will now take this session. We have from South region Dr. Sanjay Reddy. He will be talking some of the festivals of South India. From East India, we have Dr. Sambit, so he will be talking more about the East India Festival. Dr. Sv Madhu, who is will be talking from North India, and Purvi is from Western India. So all across the country, we will be talking that what are the different festival, how they can affect the diabetes. But ultimately, as I told you, it is every weekend is a festival in our country. Over to Dr. Sanjay. Thank you, Purvi.
Thank you.
Thank you,
Dr. Thank you, Dr. Bansi Sabu, and we are back as usual. I was absent for some time, and thanks, Purvi, for holding the fort. She said, no, you should be back today, and I'm here again. And what we're talking today is fasting and feasting, how it can affect diabetes across the country. We do have every sweet from every area. I think I know all of them from many, many, many places. So do you. Now, how do we control this fasting and feasting? Whether it is Diwali, whether it is a Ramadan fast, whether it's a Lent period for in the Christian calendar year, or it's Christmas. And to answer these questions, and then the diabetes patients also get sick. So what we are going to do is I will answer questions. And I'll request my colleague Sambit. I think Sambit has some problem. I think he's gone. Sambit is not there. So I'll start off with Dr. Madhu. Sir, festivals are, Sambit is again logging in. Before that, festivals, fasting and feasting are part of every culture. They are followed differently in different ways. First, as doctors, for us to respect and understand these cultures. At the same time, one of our goals is to guide our patients to better glycemic control, better sugar control, without losing the decorum of their religious faiths which they have. Saying these few words, I hand over the podium to Sambit. I think now he's logged in and all fine. So over to you to moderate, and we have all of you questions. Over to
Thank you, sir. Thank you, sir. Hope I am audible and visible, and my apologies for the technical glitches. So, at the outset, I must thank Dr. Purvi, Dr. Bansi Sabu, sir, for giving this opportunity. I think this is a very good topic today they have chosen, that is festivities and diabetes. And we all know that unity in diversity is the soul of Indian culture, and we are all proud of that. And one of the things by which we all are so glued together, irrespective of the caste, creed, and religion, is probably the festivities. And the festivities, we not only enjoy the festivities with celebrations, we are happy for the different kind of food and the culture we share. So that's the important thing. But this is the right of all people to enjoy the festivities, and people living with diabetes are no exception to that, and that's very important. And the people with diabetes should and can observe the festivities with fasting and feasting. And you have rightly told that there are some festivities where fasting is predominant, then there are some festivities where feasting or more eating is predominant. And with that, we'll start the discussion. And I'm so happy that and opportunity that we have Dr. Madhu sir and Dr. Sanjay Reddy sir is with us. So first, let us first fast followed by feasting. So if I can ask Madhu sir, can people with diabetes do religious fasting?
Okay, thank you, Sambit, and thank you to the RSSDI team for inviting me on this topic. And I think it's a very good topic to educate people on. And festivities are around the corner. also. Some of the festivals around the corner. Yes, your question was, can a diabetic fast? If a simple answer to that would be no. That's a straight and simple answer. However, there will be people who will insist that because of several religious faiths they will need to fast. So maybe we could say that certain categories it's a total absolute no, and certain categories with some precautions, some advice, maybe we could still allow them to fast. But if you ask a simple straight answer, it's a no. If type 1 diabetic, those with complications, those with very difficult control, those with history of hypos, those who cannot sense this hypos very often, these are, I think, they have no choice. They should not fast at all. Others, if possible, avoid fasting. If it is unavoidable, then consult your physician, discuss it out, and only then approach a fast. That's how
Yes,
it's put.
Yeah, I think that you have touched the very nice thing that ideally they cannot fast, but if there is any religious compulsion, they can do. But first of all, they have to consult their treating physician or doctor or diabetologist or endocrinologist. So with that, I'll come to Dr. Sanjay Reddy, sir. So we know that there are different kinds of fast in India. Like, for example, if we tell Ramadan, then that's actually pre-done. They can eat, and after the sunset they can eat. But the reverse happens when the Jain take their fasting. That is, between the sunrise and sunset they can take their feast. So the duration of the fasting also varies. Like for Ramadan it's almost 1 month, then for few others it's for 2 to 7 days, or maybe for Navaratri it's 9 days. So my question to Sanjay sir, like if someone is planning to do a Ramadan fast, then what advice and what dietary modification you can suggest actually in that?
Thank you, Sambit. I see a lot of our dear friends who come to me, or my patients who come for advice during the fasting season. And usually there's a huge crowd of them 1 month before the Ramadan season starts. Now, there are 3 types of patients. I would say I would discourage them to fast. What we discourage, as Dr. Madhu said, it is a no-no to people who are type 1 diabetes, who are with any comorbidities with diabetes, like heart disease, severe heart disease, kidney disease, nephropathy, or severe neuropathy, disability. I would discourage them from fasting, or people who are not, as Dr. Madhu said, who do not appreciate hypoglycemia. Saying that, they can, but so there is this one. They would request. I request them if they can avoid and not to fast. But since some of these people who are diabetics, well controlled on certain group of drugs, like drugs which do not cause hypoglycemia, and they are on a certain amount of drugs, their glycemia is good, they don't have any other problems, they are relatively young. These people, I advise them differently. So what we do is we change their medication pattern depending on what they are taking. Go and give them drugs which are less hypoglycemic. At the same time, we should remember any fast in our country, anywhere, is followed by feasting. The most important thing to re-emphasize the fact, yes, you're fasting, that doesn't mean you're going to be rewarded. You're going to reward yourself with all the food which you're not supposed to eat. These are no. You should remember during this 12-hour fasting, they don't dehydrate themselves too. So those who are prone and who are on multiple doses of insulin, people who are very bad glycemic control, no to their fast. So I request and deny them that they should pray to God or need their imam to take, that they will not fast this time. And only mild diabetics, a certain group of drugs which do not cause hypoglycemia, you change them to the evening, that sehri, and that is after dinner in the evening, which they break the fast and before, and in the early morning hours before 5 when they eat their meal. At the same time, advice on diet is very important. Asking them to take food, especially during breakfast, that they should take something consistent, or in the morning when they break the fast, they have to have a meal which has a low glycemic load, thus low glycemic index, but last for a long period of time, so they don't go into hypoglycemia. Most important thing is to choose drugs that doesn't cause hypoglycemia into the small population which you advise fasting. Over to you, sir. I think Sambit, your thoughts and views on
मैं
the same.
इसके अंदर एक बताना चाहूंगा, जो डॉक्टर मधु साहब ने बहुत इंपॉर्टेंट बात बोली है कि जिनको भी फास्ट करना हो रिलीजियस पर्पस के लिए, दे शुड चेक विद देयर डॉक्टर फर्स्ट। जी, मैं वापस इसको एम्फेसाइज इसलिए कर रहा हूँ कि ज्यादातर हम पेशेंट ऐसे देखते हैं कि या तो वो फास्टिंग कर चुके होते हैं और सीधे हाइपोग्लाइसीमिया में एडमिट होते हैं, या जैसे ईद के टाइम के अंदर या रोजा रखने के पहले वो 2 दिन पहले नहीं आते, एग्जैक्टली 1 दिन पहले आते हैं, साहब कल से रोजा रखना है, उनका शुगर कंट्रोल नहीं है, या जिनको नवरात्रि के फास्ट करने हैं, फास्टिंग करने के बाद के अंदर वो डॉक्टर को मिलने जाते हैं। तो ये बहुत जरूरी बात है सबके लिए जो भी सुन रहे हैं, और आगे भी इस बात को पहुंचाने के लिए कि जब भी किसी को रिलीजियस लेवल के ऊपर फास्ट करना हो तो वो अपने डॉक्टर को बिल्कुल बता दे कि मेरे को हर महीने की मेरे को साहब 11 और पूनम करनी है, या मेरे को जैन लोगों का अलग फास्टिंग होता है। एक इंटरनेशनल गाइडलाइन जो ज्यादातर बनी हुई है वो हमारे पास रमजान के लिए गाइडलाइन बनी हुई है, लेकिन रमजान एक बहुत सिस्टमिक फास्ट है जो 30 दिन का चलता है, मॉर्निंग से इवनिंग तक कुछ नहीं खाना है और रात को और सुबह अर्ली मॉर्निंग लेना है। लेकिन हमारे जो हिंदू और जैन धर्म के अंदर फास्ट है वो कभी 3 दिन के हैं, कभी 1 दिन का है, कभी एक टाइम खाने का है, कभी नहीं खाने का है। तो वो एग्जैक्टली क्या टाइप का फास्ट करने वाले हैं, कब से वो प्लान करने का है, और जब भी वो अपने डॉक्टर के पास जाए उनको जरूर से पूछे। तो डॉक्टर पहले तो ये बताएंगे कि आप कर सकते हैं या नहीं कर सकते हैं, यदि आप कर सकते हैं तो क्या क्या आपको चेंजेस लाने हैं और क्या क्या आपको डाइट पे चेंज करना है। और जैसे मैं संजय से बात बिल्कुल सहमत हूँ कि फास्टिंग इज ऑलवेज फॉलोड बाय फीस्टिंग, यानी वो उस समय ज्यादा खा लेते हैं, तो उसको कैसे कंट्रोल करना है और उसपे क्या खाने का है वो भी डाइटरी एडवाइस प्रॉपरली अपने डॉक्टर से लेके जाए, ये बहुत जरूरी बात है। सो आई फुल्ली एग्री विद डॉक्टर एसवी मधु सर कि ये हमारा, और मेरे को लगता है इसके ऊपर भी एक एजुकेशन बुकलेट हमको पेशेंट्स पॉइंट ऑफ व्यू से एक फ्लायर बनाना चाहिए, जो हम हमारे सभी पेशेंटों को बाहर हमारे सभी RSSDI मेंबर्स को भेज सकते हैं, जो हम हमारे वेबसाइट के ऊपर लिख सकते हैं नॉर्मल हिंदी और इंग्लिश लैंग्वेज में। और पेशेंट को जब वो बाहर ओपीडी में बैठे हो तो या तो एक एजुकेशन पैम्पलेट उनको दिया जा सके, यदि वो फास्टिंग करें तो प्लीज अपने डॉक्टर से इसके बारे में बात जरूर करें। ओवर टू डॉक्टर एसपी मधु सर, यदि आप कोई ऐड करना चाहते हैं।
नहीं, बस वही चीज है जो आपने रीएम्फसाइज किया। आई थिंक ज्यादातर अनसुपरवाइज्ड फास्ट टोटली अवॉइड करनी चाहिए, मतलब या तो बिल्कुल ही अवॉइड करें फास्ट, अगर फास्ट करें तो डेफिनेटली सुपरविजन में हो, इन द सेंस कि पहले से आप प्रिपेयर्ड रहें कि हमने फास्ट करना है। अगर आप कंट्रोल बिगड़ा हुआ है, जैसे डॉक्टर बंसी साहब ने बताया, आप अगर समय रहते अगर फिजिशियन से कंसल्ट कर लेते हैं तो आपकी शुगर कंट्रोल में लाई जा सकती है, आपकी दवाई में कोई चेंज करना हो, परिवर्तन करना हो, वो भी किया जा सकता है, और आप फास्टिंग को अप्रोच प्लान्ड तरीके से कर सकते हैं ताकि आपको बाद के कॉम्प्लिकेशन ना हो, शुगर बहुत ज़्यादा बढ़ जाए या बहुत ज़्यादा घट जाए और उसकी वजह से आपको इमरजेंसी में दाखिल ना होना पड़े। इसके लिए जरूरी है कि आप अपने फिजिशियन से संपर्क जरूर कर लें और प्लान करें फास्ट कैसे करें।
एक कॉमन मिथ से मधु साहब आपसे पूछना चाहूंगा, ज्यादातर पेशेंटों को ये होता है कि थोड़ी सी आज मिठाई एक्स्ट्रा खाई है, या आज मेरे को फास्टिंग के बाद ये मेरे को कुछ ज्यादा खाई है, तो मैं क्या कुछ एक्स्ट्रा दवाई लेके चला लूं या कुछ एक्स्ट्रा डोज ऑफ इंसुलिन ले लूं। तो ये एक बहुत कॉमन मिथ है और ज्यादातर पेशेंट ऑन देयर ओन दे वांट टू करेक्ट इट। आज 2 गोली खा ली, आज 1 खा ली, आज कुछ ज्यादा मिठाई खाई उसके साथ खा ली, तो ये इसका कहां तक तथ्य है, कैसे एक्स्ट्रा दवाई उसको कंट्रोल नहीं कर पाएगी या कर पाएगी। ओवर टू डॉक्टर मधु सर।
हाँ, नहीं तो आई डेफिनेटली दिस इज अ वेरी इंपॉर्टेंट पॉइंट, और मैं ये कहना चाहूंगा तो मरीज को खुद अपने ये टैबलेट और वो ये जो इवन नॉन फास्टिंग सिचुएशंस में भी कई बार रहता है मरीज के लिए कि मैं ज्यादा खा लूं और 1 गोली ज्यादा खा लूं या इंसुलिन लगा लूं, उससे मैं बिल्कुल सही रहूंगा। ये धारणा बिल्कुल गलत है मेरे हिसाब से। स्पेशली ड्यूरिंग फास्ट यू शुड टोटली अवॉइड सच थिंकिंग एंड प्रैक्टिस बिकॉज इट इज गोइंग टू डू मोर हार्म देन गुड। सी, एक दिन आपने एक स्वीट एक्स्ट्रा खा लिया, आपका एक दिन शुगर बढ़ जाएगा, उससे नुकसान कम होगा। अगर आप उसके लिए आप दवाई सोचते हैं कि आपके कंट्रोल में 1-2 गोली डबल खा ली या इंसुलिन 4-8 यूनिट ज़्यादा लगा लिया, उससे नुकसान ज़्यादा होगा। आपका शुगर बहुत कम भी हो सकता है, कभी ऐसा भी हो सकता है कि आप उसके वजह से आपको हॉस्पिटल में दाखिल होना पड़ जाए। तो ऐसे ना करें आप। इसीलिए तो हम बार बार कह रहे हैं कि फिजिशियन से पहले ही संपर्क में आ जाएंगे तो ये सारी चीज़ें आपको समझा दिया जाएगा कि प्लान तरीके से आप क्या क्या चेंजेस कर सकते हैं। so that you don't have to do some those type of knee-jerk type of reactions. That is important.
एंड
Sir,
दूसरा डॉक्टर संजय, बहुत कॉमनली ये देखा गया है कि जो फिस्टिंग करते हैं उस समय तो बिल्कुल मॉनिटरिंग नहीं करते हैं. मतलब ओनली वी कैन चेक इट ओनली बाय गेटिंग देयर A1C. Suddenly we find their A1C is uncontrolled while the patient's regular fasting and post-meal sugars are getting controlled, but neither they check their post-dinner sugar, which may be the major reason why their sugar is uncontrolled, or during feasting time they never check their sugars. I mean, when their lunch is very heavy or when their dinner is very heavy, they never check their sugar, and then we find only in A1C it is coming high. So, to adjust the dose for the doctors also become very difficult. So how important the monitoring, how you schedule the monitoring for the patients regularly who may be on oral anti-diabetic agents or maybe on insulin, particularly to teach or educate him during fasting and feasting. So now again Sambit is there, but Sanjay, you can answer it, and then further question can be asked by Dr. Purvi and Dr. Sambit.
Yeah, that's a very good question, Dr. Bansi. One of the most important things, जो भी मरीज फास्ट करना चाहते हैं, ये समझे, most important, some of them are very to check their blood sugars during fasting also. Some say, no, religiously it is not allowed, but religiously you can check your, I tell them, if you want to be religious, also religiously please check. If they are on insulin, religiously please check, because this is also a religion. Diabetes also is a religion which you follow. You have been forced upon it. It's a universal religion for you. Please take it. What you need to do, follow, monitor it. The most important thing is to monitor at least 3 to 4 times, especially if they are elderly, if they are on multiple drugs, if they are on drugs which cause hypoglycemia. Now, other thing is, most of the fasting, most common thing which you find is during this, even during after Ramadan, people come with weight gain, with very elevated sugar, though they were fasting. Sir, aap fasting nahi kiya, or they've only feasted, because they reward themselves with so much high calorie food. I tell them, yes, you had your, you broke your fast, please check after 2 hours and see what your sugars are. It will be 400, 500, whether they are on OHS. Once, at least do it on the first day. You will know what you have eaten and how much you should eat, and keep a track of this. They should, and religiously check, and the monitoring should be more intense. The most important thing is to educate them about hypoglycemia and hyperglycemic symptoms. Tell them if they have low sugar, आपको थकान लग सकता है, आपको दिल धड़कना शुरू हो जाता है, sweating हो सकता है, and you may have a headache. If you're feeling unwell, please check your sugar. Not only during fixed hours, at least 4 times a day, or after one at least after one major meal. One before each meal, before at least once it's 8 hours, one after a meal, please check. Another thing which I ask them to do is explain to them the symptoms of low sugar, and also if they're passing urine very frequently, they're feeling very tired, and if they have any sensation of vomiting, or if they're feeling very uncomfortable, they have to check their sugars, because they may be going into very low sugars or can be having very high sugars. Over to Dr. Sambit for next.
Yeah, I think that was quite good. First of all, सभी जो पेशेंट्स अगर सुन रहे हैं, तो पहले जैसे मधु सर ने बताया कि हमें पहले वो फास्ट करने से पहले डॉक्टर से सलाह लें, फिर फास्ट करें, और अगर शुगर सही तरह का है और वो फास्ट कर रहे हैं तो फ्रीक्वेंटली मॉनिटर करें, जैसे संजय रेड्डी सर ने बताया. सो बहुत इम्पोर्टेंट है कि अगर शुगर फ्लक्चुएट होता है तो मॉनिटर करें एंड उसको कंट्रोल में रखने के लिए सही स्टेप्स लें. यहाँ पे कुछ डॉक्टर्स भी एक्चुअली सुन रहे हैं, सम डॉक्टर्स आर आल्सो लिसनिंग. सो माय क्वेश्चन टू मधु सर इज दैट what are the oral anti-diabetic drugs which we can give during fasting, and how we can monitor the insulin or change the insulin, especially during structured fasting like Ramadan and also in Navratra and all?
Okay, thank you. The oral anti-diabetic agents are very simple. The decision is simple. You see, the primary concern, if the patient was otherwise controlled, is hypoglycemia during fasting, and therefore any drug which causes hypoglycemia is best avoided. So the best would be, and especially if the patient has come to you and you plan the fast, it's much better to put the patient on agents which do not cause hypoglycemia themselves, and anything that affects or focuses on other mechanisms like insulin resistance or any other form of pathways is welcome. For example, the best drugs to choose would be you could give metformin, you could give DPP-4 inhibitors or GLP-1 based therapies. These are both good. If you decide on a sulfonylurea, of course, it should be a short-acting one. You could give a ripaglinide, for example. You could give a gliclazide, for example. And even glimepiride is okay, but definitely not glibenclamide or the traditional oral sulfonylureas. The problem with using SGLT2 inhibitors, although they don't cause hypoglycemia, is that, as it is in fasting, you also tend not to take enough fluids if you've not been advised properly to continue a fluid intake, and some fasts they may even have to restrict the fluids. And in that scenario, taking SGLT2 might also add to the problems of dehydration and their own consequences. And therefore, I think the best agents would be, let's say, maybe metformin, maybe DPP-4 inhibitors for sure, sitagliptin or something like that. And if you were to use sulfonylureas, they should be short-acting. You could use ripaglinide and acarbose. These are the drugs I would suggest would be better options. Insulin, if somebody is taking insulin, as I said in the beginning, it is always better not to go on a fast. However, if it is totally unavoidable, an easy way of thinking is that, especially for Ramadan, for example, where your cycle is somewhat reversed, what you do in the morning is actually done at night and vice versa. So you could just change over. You reduce the dose to, let's say, 50 to 65% or so of the total, and then reverse the ratios from morning to evening. That tends to work. But important thing to remember, at least for the insulin users, is you need to much more closely monitor to make sure that you don't get into hypos. So these are the basic things that I would do. And even with the oral anti-diabetic agents, I think monitoring, as has been suggested earlier, should be done much more frequently. And the major concern actually is hypo, but sometimes the concerns can also be hyperglycemic crisis, which we need to avoid. And therefore, we have to tailor the dose of insulin to control the sugars.
राइट सर, थैंक यू. सो संजय सर ने और मधु सर ने दोनों ही बताया कि हाइपोग्लाइसीमिया एक इम्पोर्टेंट कंसर्न है फॉर पेशेंट हु आर गोइंग फॉर फास्टिंग एंड स्पेशली रिलीजियस फास्टिंग. सो संजय सर, आपको एक क्वेश्चन है जो बहुत सारे पेशेंट्स भी जानना चाहते हैं कि हाइपोग्लाइसीमिया का सिम्टम्स आपने बताया, एंड इन सिंपल टर्म्स हाउ वी कैन मैनेज ए हाइपोग्लाइसीमिया एट होम एंड व्हाट प्रिकॉशंस वी शुड टेक टू अवॉइड दैट, and how we can consult and modify the drugs.
Thank you, Sambit, for that question. The most common symptoms of hypoglycemia, as your sugars are falling below 70, some people may get the symptoms a little early. It depends. Some may not get symptoms. You should understand that is why monitoring becomes important. There are three types: people who get symptoms, people who do not get symptoms. Elderly people repeatedly it's called hypoglycemic unawareness, so they should know about this. That is why you need to ask them to monitor at regular intervals, so you know whether they're not going into hypoglycemia or not. One of the most commonest symptoms, suddenly patients starts feeling, some of them start feeling hungry, may get a headache. It is not that all symptoms will be present in everybody. Please remember, heart, dil dhadakne lagta hai. Heart may start beating fast. They may start sweating. They may start talking irrelevantly. So these are some, and then if it continues, then they may fall unconscious. So if they find these symptoms, even before they can check, and if they have taken anti-diabetic medicine, the best thing to do is, if they have, idea is 15 grams of glucose. Now, it is not available every day. There are some tablets which are available for correction of hypoglycemia, but not everybody uses them. They contain 4 grams of glucose. If they have met you and if they have it with them, ask them to take 3 of them. Only they should take it if they are conscious and they are able to drink it. If they are unconscious or if they are needing support from somebody else, please reframe and tell the attender, don't feed the patient when he's unconscious. You have to take him to the hospital. Nothing is going to happen. They will recover. If not, any sweetened juice which they have, please ask them to take that. Any sweet drink. Give some time. If he recovers, please have a small meal, meaning to say something to eat which contains carbohydrate, rice ki ho, your bread, or some sandwich, whatever is there, they should also eat. The hypoglycemia is not going to be corrected. And also, don't again after some time have your regular meal and check after 2 hours. Sometimes most of these low sugars is followed by a bout of high sugars. So these are the simple things. Whatever they get, whatever sweet, maybe sugar water. The idea is if you take it in a liquid form, it's faster to absorb. So glucose has the fastest absorption rate. If you the anhydrous glucose, which is available in local pharmacy, three teaspoons of it will give you 15 grams of glucose. It's an ideal correction, but whatever is available at that point of time.
Thank you, sir. I think that's very important tip for our patients, that how they can manage hypoglycemia and how they can know that they are having hypoglycemia and how they can come out from that episode, especially when fasting. So I think we have discussed enough about fasting during festivals, but festivals are meant for eating actually. So now coming to some of the feasting festivals, like after any fasting episode, there is a feasting, as Madhu sir has told. So we have Diwali, Durga Puja, Ganesh Puja, all are coming in sequence in the near future, in the second half, followed by Christmas and all. So, and all of us enjoy with food. So diabetic patients or people living with diabetes should also enjoy their feasting and going out and enjoying. So what exactly we can actually choose from the diet so that their blood glucose won't get high, especially during the feasting? So Madhu sir, can you just elaborate that even during feasting, how they can maintain a proper blood glucose, what precautions they can take, especially while choosing the diet, and how they can modify the diet in the rest of the time?
Yeah, you see, feasting, if we go directly by the word feasting, then it's more to do with the quantity than just the quality of the foods that we're eating. We do understand that in most festivals, the quality also is different. You tend to take more of sugar containing foods, you tend to take more fat containing foods, and you tend to take, the kind of flours that you use for various sweets are also going to raise your blood glucose quite a bit. So it's kind of a panacea for raising the blood glucose, the feasting component of festivals. And there's no bar on the quantity, so it also tends to raise the blood sugar fast and also pretty high. So what we need to understand is that while one can be a little liberal during festivals and allow a little bit of consumption of sweets and sugary foods, one should keep them in check. I will not advise somebody to take huge quantities of these foodstuffs while breaking a fast, because that is bound to put the entire balance of hyperglycemia and hypoglycemia into disarray, and you're going to have fluctuations which may sometimes be difficult to control. So depending on what you're taking, and particularly if you're taking insulin, it should not go too much out of hand. Yes, a little bit here and there is okay. Now, what about the planning part? How do you plan your feast? Plan your feast. You should plan your calorie levels much earlier. Overall, within the ambit of how much you can take, you can give the elements of taking relatively sugary stuff. In fact, that to some extent helps also. It is generally advised in planning a feast that while you are going on a fast, you take a foodstuff which has a lower glycemic index for the same amount of carbohydrate, so that the effect of the glycemia lasts longer and prevents a hypo. And while you're coming off the fast, it may be better because you're already on the verge of getting into a hypoglycemia. So maybe taking a simpler sugar would help raise the sugars to a level which are reasonable. So it's better. To that extent, taking a sugary food at the time of release from fast is okay. But the quantities one has to keep in mind. It should not get out of hand. You can take a free sugar. You can take a maida containing sweet. You could, but if you add too much of fat, again, it'll delay the absorption and the effect that you're seeking will not be achieved. So we should be a little cautious. So I think overall, I think the emphasis should be, while you allow a little bit during festivals, the quantity one has to keep a tab on, and with the full knowledge that it's going to raise your blood sugar a little bit, but don't let it go out of hand and take too much of a festivity kind of a meal at the end of your fast. That's how I'll put it. In festivity in moderation, or feasting in moderation, if that words can be combined, it should be feasting in moderation.
Yes, sir. I think that's very good. You have told that feasting in moderation, and not only that, the quality has to be looked into. The quantity or the portion size is also important. So, if you are taking something with more calories, then reduce the portion size. So that will actually help you.
Yeah.
So, yes, sir. So with that, I'll actually just an extension for that. So I'm just asking, even if not in fisting, for type 1 diabetic patients, if they are going out and on insulin, so what are the tips you want to give, Sanjay sir, to people who are suffering from type, or people with type 1 diabetes, they are going for parties and all, or any festive occasion?
Yes.
So
I have
how they can manage that?
Yes. So type 1 diabetes children or people suffering with type 1 diabetes usually are on 4 types of insulin, or they can be on insulin pumps or multiple daily doses of insulin regime. Now, the most important thing for people who are going outdoor, 2 types of things. One, if they're going outdoor, camping or staying away with friends. Second, partying. Now we find these adolescents, type 1 adolescents, who go, so before they go, they have to check their sugar. And based on this, if they are taking their short-acting bolus dose of insulin, and if they should be taught, I feel that all type 1s, though very difficult, should be taught some basic concept of carb counting. They have to hydrate themselves well, drink a lot of fluids, that is water, non-sugary liquids. At the same time, when they should check the sugar free meal. If they are feasting, they should know some amount of carbohydrate counting. They should try, even if they're partying, to moderate the level of things which they are not supposed to eat, calculate the corrective dose of insulin which they have to take. If they are trained to this extent, they should do it. Now, another thing happens. These kids take the usual dose of insulin, have sometimes the quantity of food, maybe with high glycemic index, wouldn't last long, and they start dancing or going in a party. They are prone, because that's not their usual activity. Then, if they combine with alcohol, especially during their partying time, which you see, that causes severe hypoglycemia later on. So you should tell them that they shouldn't consume alcohol. It's okay if they want to dance, or they want to dandiya, or play with friends, whatever it is, but they should be very careful that they can go into hypoglycemia later. So these 3 things are very important. Check your sugars pre, calculate the amount of bolus dose you're going to give. If you're eating a little more at that time, which is not encouraged every time, yes, feasting in moderation, but make sure you take the corrective dose, whichever is, or consult your doctor. I'm going like this. Can you help me? What I should do at the time? But this shouldn't become a routine that every day cannot be a party. Right? It has its own limitations. And post the party, if they are into any rigorous activity, they should be told that they can go into hypo. So and they should hydrate themselves.
Yeah, I think that's very important for a person living with type 1 diabetes. They can go for party or they can do exercise, but before that, they have to check their sugar, do everything in moderation, and adjust the carbs. And they should have minimal amount of knowledge about the bolus doses, how they can. I think that's pretty important. So the next thing is that if with fasting, there are a lot of news which is coming up that intermittent fasting is good for diabetes management and all. So, Madhu sir, can you just highlight what is an intermittent fasting and whether they are good in a patient with diabetes?
Yeah, intermittent fasting is primarily for with keeping reduction in weight in mind, and it does work. And especially if you take your if you have an interval between 2 meals, which is a fasting period of, let's say, 12 to 16 hours, that is supposed to based on your body metabolism, help in reducing your weight. So for obese diabetic particularly, intermittent fasting is recommended. Even if he's not diabetic, intermittent fasting could help cut down his weight. So intermittent fasting does work. That's number one. But that's not the same as saying that an occasional fast is same as an intermittent fast. If that has to be on a regular basis, in a planned manner, at a fixed time, with a fixed interval, and if you do that, then your sugar controls are already taken care of, because your regimen is already pre-decided, your drugs are already pre-decided. It's not a change from a routine, and your sugars are already in balance. So you continue your intermittent fast, and that helps you also reduce your weight, helps your diabetes in the long run as well. So that is intermittent fasting. Sure, it does help, and there are easy ways of doing it. Like it could either be, let's say, an early dinner with no carbohydrate, and then have a breakfast, let's say at 8 or 9 o'clock, and maybe 6 o'clock or 7 o'clock or so, if you can have your last meal and not have any carbohydrate after that. That is one way of extending your fasting period. Others who are more used to taking breakfast, let's say at 10 or 11 o'clock, depending on what they do in their lifestyle, can accordingly have an interval of about 12 to 16 hours prior to that, when their last meal would be. And these measures, because these are planned activities, and that's the reason why we were insisting, even for the festivals, the fasting has to be planned and discussed with the physician, so we can get things under control, and also plan out what we eat and what we don't eat, how much we eat, how much we don't eat, how much do we monitor, so that we don't land up in problems. Here it is expected that you're already in touch with your physician, already things have been planned out. So this fasting period, while it is a fasting period, while it is a little bit prolonged, it is taken care of because it's a planned activity.
Yes, sir. I think that's very important, because many times people actually think that probably by doing some religious fasting here and there, in once in a month or 1 or 2 days in a month, that's an intermittent fasting. And some patients have actually told that, doc, I am doing intermittent fasting, and then they come out that once in a month, 1 day they do fasting. So intermittent fasting is basically a structured fasting, and it has got beneficial effects mostly in obesity, and to some extent it's beneficial for patients with diabetes, but it has to be strictly monitored by a practitioner or a physician or a doctor. So that's important. So next question to Sanjay sir, because this is a very practical question. बहुत लोग पूछते हैं कि sweet without sweets, that means for festivities they want to take some sugar free sweets and all. So what's your take on that, and your take on artificial sweeteners for patients with diabetes?
Yes. Now, this is a sugar-free sweets. Now, they call them sugar-free, but they are not calorie-free. So please remember this. They are sugar-free because they use a lot of fat, dry fruit, and nut. If they've used only nut and a small amount of dry fruits without artificial, they may have used artificial sweeteners, they are okay. But you should remember, all sugar-free. Now, for example, even some bread which is supposed to be no sugar will have more fat, because to make it palatable. So even there, my question is, please have it, but have it in moderation. The fat content and the calorie content sometimes is almost the same, or it is in par with it. But if they are really made with very less of fat, less of other things, but little bit of artificial sweetener, they have taken once a while, I don't think that there should be a question. Now, artificial sweeteners, yes, some people don't want to take, but a lot of data saying that artificial sweeteners, people can put on weight because foxes the brain, saying that you had something. But natural artificial sweeteners, please go ahead, they can, but in moderation too, not to use too much of them. This is my thing. I have seen sweets which they get in, but the sweet, actually I've tasted them and I've had them and I said, what is this sugar-free sweet? When you compare, the calorie count is not very different. So take in moderation. Take sweets which have lighter, probably which have less sugary ones, probably prepared at home with less fat. I think that's much better.
Yeah. Anything, Madhu sir, you want to add to this?
No, same thing. Especially if we are talking about a religious fast, and especially if it's not a prolonged fast in terms of number of days like Ramzan. So just when coming off the fast, you might as well take sugar and don't bother about an artificial sweetener, But as I said, you keep the quantities or the overall feasting to a limit. I mean, that will help, in fact, in bringing back what could be a potentially hypoglycemic situation earlier to normal than otherwise. But and if you limit the total quantity, it will not land up in too much of high sugar. So I think I would prefer a sugar to an artificial sweetener in that setting, in fact.
Yes, sir. I think that's very, very important. And sugar-free sweets are actually not low in calories, and neither they can reduce your blood glucose. In fact, you need to see how much fat, how much simple carbohydrate have been added to that sweet and take accordingly. For example, in our part, we have different types of sweets, but like rasgulla and all, they are having high glycemic index and very high blood glucose fluctuation may happen. But there are some sweets like chena podu, which is basically cheese which has been baked. Yeah, and people add cinnamon to it rather than the simple sugar. So that's in a small quantity one can take. So if our patients ask that what sweet I need to take, then probably we can allow once in a while with a very small piece of that. So, and I'm sure in different parts of India, similar sweets are available. So it's better to take it wisely and in a proper quantity rather than in a larger proportion. So
sometimes the term sugar-free sweets, sends a wrong signal to the patient that since it is sugar-free, he can consume any amount of sweet, nothing is going to happen to him. Even in that sense, I think fundamentally it's not a good thing to propagate, because they get a false sense of security. And as Dr. Sanjay said, the amount of fat that he's going to consume by consuming each additional sweet is going to be so much that he is not going to understand the ill effects of such sweets. Just the sugar-free and the term sugar-free is going to put him off.
Right.
And what happens is they don't eat, not only during festivities, they continue it throughout. The other thing which happens is you ask them to take one during it, it's one, and it becomes every day one, which is not a good sense. This is what you see. I have a question, sir, which is very typical, especially in areas where they grow mangoes. So we, close to Bangalore, probably Delhi, Uttar Pradesh, the pockets of Bengal, Maharashtra, where they grow mangoes and chikus, which are in huge amounts, and they're hugely liked by everybody. Nobody says, not many dislike these fruits. Now, during these seasons, which are the 3 months of these fruit season, especially between May and August, and people don't stop with one piece or one mango. They will eat 8 or 10 of them. So this is a very big urge. Sir, mango season, I'm not coming. My A1C is like, they have 3 kgs up and my A1C is 11. Now, this is a big problem. Now, we've come out and open and I grow all types of mangoes. So this is a very big problem. Majority of people coming, probably the type of fruit even consumed in huge quantities. Also is like feasting every day. So I think moderation on the fruit, which also is equivalent to something like a sweet, the mangoes. And Purvi is there; she can join too and tell us. In Maharashtra, they have the same problem. They have a huge amount of chikus, one of the best fruit-producing states in India, and a lot of mangoes. Yes, moderation is the key, and she can add her experiences at Maharashtra and people coming in the 3 months. Say, "Mom, bahut kha liya."
Absolutely. I think it's worth doing a study to see, what happens before and after the mango season. Yeah, and the mango season is quite extended in Maharashtra because from the Konkan belt you get mangoes all through August as well.
Yes.
So I think that extended period is definitely a killer.
But the fruit is good, meaning to eat in smaller quantities, but it's consumed like 8 or 10. So I don't much.
So those 3 months are something like a mango festival. It's still a festival.
Absolutely.
Chico festival. And then in 4 months, 6 months, 3 months, it is like after 3 months they would come with A1 season. No, sir, I've been eating every day. So it's a common thing. I can't resist. Once in a year the season comes. How do you tackle questions like this? It's very difficult. Some with any answers, I don't
think-
know. What is
Yes, sir.
the-
Yes, sir. The same everywhere. It's mango season, mango festival. So the thing is that mango is not that bad actually if we do
Yes.
certain precautions. Like I think if you are taking one this fist
It's
of
not a
mango, a
problem.
small mango, then probably it will give 15 grams of carbs, and it has got good fiber amount also. But the
Yes.
problem is that, the solution is that we can take as a snack rather than with a meal. So what happens in India is that after our lunch, we
Meal.
take one mango as a just as a
Not
sweet
one,
dish, and
Sambit,
that
it is
adds
like
to the many mangoes.
One is an
2 or 3 mangoes.
understatement.
one is no problem.
Right.
And
So
and
moderation is good.
So what we do is, when they visit us in the month of March to April, we, in their diet plan itself, we kind of fit it in. So that,
Yeah, I
the
mean-
number of calories and the quantity is also well
Fitted.
defined for them.
Yeah.
Very
And
good.
also there is one tips which I got from a very reputed dietitian of Madam Shilpa actually. So she was telling in one of the session that if you cut it and make it like cubes, then the surface area increases, and you
Yes.
take it slowly so that you won't take more. So
More.
one
Anyway,
tip of
some
that.
good,
So
good,
anyway,
good
we need
suggestions.
to we need to reduce the quantity and in moderation. So everything in moderation.
Thank you. I thought I'll get up this question. It's also like we eat 8 or 10 of them, and then they cause a lot of issues.
Right. So, Dr. Purvi, any question from audience? Or?
No, none so far, but I have a question, and actually I want you all three, experts to give a message out to the general public as to, one, with respect to, why sweets in moderation, even if they don't know, or they don't think they have diabetes, why moderation is good. And the second message would be with respect to our Defeat Diabetes campaign, where we are encouraging everyone to test their sugars. And so, a few words from you of encouragement and endorsement would be very, very welcome. So we can start with Professor Madhu, sir.
I think regarding the sweets, I think Dr. Sanjay mentioned it in quite detail. I think it's not just the sugar that's harmful. It's the calories which are far more harmful, because a lot of fat that goes into making most Indian sweets, and therefore, even if sugar free, it's not good. So my message to everybody will be that once in a while consuming an occasional sweet is okay, and don't bother about sugar free on that day. But by and large, don't consume Indian sweets in particular, any sweet for that matter, on a regular basis, and hope that your sugars will be controlled despite, and your weights will be maintained despite all this. So it's fundamentally harmful, more from the calorie point of view, little less from the sugar point of view. That's number one. So the message is clear. So during a festival, a sweet that day is okay. The second question regarding the Defeat Diabetes campaign, I think on a more serious note, this is, I think, a very, very wonderful campaign, and I would urge all the people who are listening in and joined in today to definitely join in this campaign, do their monitoring of sugars if they're already a diabetic. If they are not, at least test their sugar to find out if they are diabetic. And if there are any relatives in the family who are diabetic, then all the more reason why you need to check your sugars. And then make sure that you don't have diabetes or a pre-diabetic situation already, in which case you need to take some precautions. If you're overweight, again, you need to check your blood sugars. So the message generally is that you please check your sugars, even if you're not a diabetic, to detect your diabetes early, detect pre-diabetes so that you can prevent diabetes. If you're a diabetic already, it will help you monitor and keep your sugars under better control.
Thank you,
Perfectly
sir.
said, sir. Go ahead, Dr. Reddy.
Yeah, I've gone another tangent. Yes, Indian sweets, and you got the message from Dr. Professor Sv Madhu. Remember, guys, you're all drinking milkshakes, eating pastries, ice creams, and Purvi saying, "Where's my next ice cream?" And then all the best stuff loaded with a lot of fat. Your puff pastry, your peas. So even these, they contain more calories. Suppose you take a glass of milkshake from one of the big chains, and or a dry fruit milkshake, please remember, and the amount of sugary juices. Now, even these are sweets. Please remember, take them in moderate quantity, even if you don't have diabetes, because they not only give you sweet, and what happens when you take one sweet, you want to take another one. That's how the carving is. So please reframe from it. Take it in minimal quantities when you need to take it. But if you're a diabetic and you're not controlled, I would say please abstain from it. Take it wherever it is not, wherever you cannot say no. Probably your son's birthday, you want to have a piece of the pastry or the birthday cake, yes, please. But don't have it on a regular basis. Sweets, Dr. Madhu has given you an heads up, and I've told you all the other things which are there. Ice creams, pastries, milkshakes, they have more calories than that of an Indian sweet. Please remember that too. Second, our Defeat Diabetes program, one of the initiatives for the first kind. Please take part in it and make it a successful program. Test, treat, and track. So I would urge that all of you test your sugars. Make it a habit that each one of you at least test 10 people. Make this a chain. I'm telling this message. Don't do anything. Just test. See if you can test 10 people around you who do not have diabetes, and you know the difference. And if you already have diabetes, treat it well and track them that you don't have complications. I think this program should be taken off to another level. Thank you very much. And this is my message for all the sweet loving people there.
Fantastic. Thank you so much. Go ahead, Dr. Sambit.
Yeah. I think today we had a good discussion. We discussed about all the festivities. So it has fasting, it has feasting. So for fasting, I think all of us have agreed that before going for fasting, you must consult your doctor or a physician that whether you can go for fasting or not. Before fasting, keep your blood glucose well under control. Change the oral anti-diabetic or insulin as per the prescription of the doctor. Be hydrated throughout. And for feasting, as Madhu sir and Sanjay sir has rightly told, that moderation is the rule. So it's not about only the simple sugar. It's about the calorie, the total calorie that the food contains, and the portion size is very important. So that we can do. And testing is very, very important. You must do SMBG. You must check your blood glucose more frequently. Regarding the Defeat Diabetes program, I think it's one of its kind in the world, and it's a very successful campaign by RSSDI. And testing, tracking, and treating are the mottos in that Defeat Diabetes. So we must start a chain, as Dr. Sanjay Reddy has told, that testing is very important. At least we must test the sugar of the relatives of people with diabetes and at least track them and treat them. So I think that's a very ambitious project, and we all wish it will be grand success.
Thank you so much for those wonderful, wise words. And these three pillars of RSSDI have given us really very cogent messages with diabetes and without. So yes, we are in the midst of a festival bonanza, but we all need to be careful about how we are going to celebrate. And celebration is not equal to eating sweets or consuming sweets alone. So in that spirit, I must thank each one of you, Professor Sv Madhu sir, Dr. Sanjay Reddy sir, and Dr. Sambit Das, for your very valuable contribution to this episode. And of course, taking the time out from your busy schedules and being there for RSSDI and their members. This video is also going to be uploaded on the RSSDI website for future use and reference by all the general public as well as physicians. And from today, we also started streaming this live on Instagram, on the RSSDI Instagram handle, which is the first time that we are doing. So with that and your blessings for the Defeat Diabetes campaign, I'm sure this is going to be a massive success. And thank you once again from the entire team of RSSDI social media, which includes Dr. Sanjay Reddy as well. Thank you so much.
Thank you, Purvi, for the lovely moderation and putting all of us at ease. Thank you very much. Thank you for getting all of us together. Thank you, sir, Professor Madhu, sir. Thank you, Sambit, for this
Thank you.
time. And thank you very much.
Thank you.
Okay.
Thank you so much.